What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
I'm doing wonderful. Thanks again, everybody, for listening to us. Like I say, every podcast, we really appreciate it. Please let anybody you know that may benefit from this podcast, let them know about us. This podcast is the Well Man's Podcast, man as in human. This means that it is also for women. I'd say more so for women. Women are the ones who seem to be more concerned about their healthcare these days anyway. So
yeah, unfortunately, that is true.
Right. So yes, if you think this information will help anybody, please pass it on.
Yes, comment, subscribe, resubscribe, unsubscribe, resubscribe. Just spend all day resubscribing, unsubscribing, drive up our numbers, and leave a review. That'd be super helpful, just in letting us reach more people and help more people.
So I think that today's podcast is a great podcast to do because it can help relationships be more at ease, right? Could you imagine being in a relationship where you are snoring? One of the partners is snoring the whole time and you can't sleep. And it always happens that the person that snores falls asleep first.
Yes, indeed.
That seems to be a rule of thumb of the universe.
Yeah, you're definitely right.
Anyway, so snoring is really disruptive. It can, disrupt relationships, definitely put a strain on it. But also it can be a sign of more significant health issues. Snoring is basically a closed up airway, so to speak, where you just can't get air into your lungs, and the tissues in your palate and throat are kind of narrowed, and every time you breathe, they kind of vibrate. And you get this, could range from any mild to very loud, horrible sounding monster type sound with every breath. But anyway, it can be really disruptive. Nearly everybody snores now and then. So, we're not trying to put you down for snoring. I have been accused of snoring myself. Actually, last 2 days ago, I was accused of snoring by my
I feel like we've all at least been accused of this.
Right. But for some people, it is really an issue. It can be a chronic problem, and it can also lead to serious health conditions. So the point of this podcast is, okay, so what can we do about it, really? And so we'll get to that. And snoring is significantly related to obstructive sleep apnea, which is a much more serious condition. In fact, 75% of the people that snore probably have some form of obstructive sleep apnea. And that is, the main sign or symptom of that is snoring is there, but also where people have to gasp for air or stop breathing while they are asleep. Yeah. One of the reasons why your throat kind of narrows when you sleep, it's also position wise, right? So if you're laying on your back, your soft palate kind of falls back into your throat. But also the other thing that's really fascinating about this is once somebody goes into deep sleep, they basically have their muscles completely relax and they don't stay toned. So that's another reason why that can happen. So, and that really sucks, right? Deep sleep is, considered your restorative sleep. Check out our sleep podcast on that. But if that happens where your throat kind of closes up when you go into deep sleep, you immediately gasp for air and come right out of it. And so a lot of these people with obstructive sleep apnea are not getting deep sleep, and it leads to serious issues later on. And it can be pretty bad. Just so you know, like people with like if you don't know if you snore or have sleep apnea, some of the signs and symptoms, like upon your waking hours, is like, being still sleepy, like you never feel like you got restful sleep, headaches, definitely sore throat, dryness in throat. You just feel restless. It's closely correlated with high blood pressure and cardiovascular disease. And the other thing also about snoring and sleep apnea is correlated with age. So as we get older, The muscles also lose their tone all over in our throat too. It can lead to snoring. So just age is a risk factor, but also children can snore too, although it's rare. But if children are snoring or have sleep apnea, this can be a cause of behavioral issues, right? So if you're not sleeping and your sleep is being disrupted, of course, you're going to have like poor attention span. You're going to have, maybe, get the diagnosis of ADHD, ADD, poor performance in school, just because you're not getting appropriate sleep.
Yeah. It causes me to be an asshole.
Yeah, everybody, right? If you don't get sleep, I mean, talk about being irritable, right? And yeah, you totally lose that the caution signs in your prefrontal lobe, right? Like you do things you don't normally do. You let down your defense barriers, or you just get irritable and snap at people. So sleep is huge with that. Other things that can lead to it, I also tell people, like, things that you can
snoring specifically.
Yeah, right. So anybody who has sleep position is huge, right? So a lot of people know if you're snoring, if you're laying on your back, you're more likely to snore. Gravity just pulls on those soft tissues in the back of your throat, pulls them down, kind of narrows the breathing airway. Weight is a big issue. So anytime you gain weight, you're gaining weight all over, even in your soft tissues, in your soft palate. It closes. People who have thick necks or put weight in their neck will narrow their breathing. So weight loss is a great way to help combat that, especially if you're overweight. Now, again, there's plenty of people who are not overweight. I should have a couple clients who are underweight who snore like champs. I mean, according to their spouse, I'm trying to find ways to get out of it. So other ways that can bring it on is alcohol is another thing, right? So alcohol is correlated with snoring. So cutting that out if you drink. Another thing is allergies, like nasal congestion is a big one. Right. Having a deviated septum, nasal polyps, anything that will restrict it breathing, it can be a big issue. Men tend to be more snorers than women, although women also can snore. Men are at higher risk for sleep apnea also. Family history is definitely related to that also. What else? I mean, I guess let's talk about things, how to prevent and things that you can try to help prevent it from happening. So knowing what we just said, so losing weight. We know that sleeping on your back is an issue. So sleeping on your side. A lot of people will get like a body pillow. I actually had some patients who didn't have that, or were going to get one, tie like a tennis ball or tape a tennis ball to their back along their spine. So if they roll over on their back, it'd make them feel uncomfortable. So they go back over onto their side.
That's interesting.
Yeah. So that is one home remedy you can try to stay on your side. You've seen these nasal strips, right? People wear those to kind of open up the nasal passages. Anything that does that is going to help. Treating nasal congestion, we talked about neti pot before. If you have any allergens, keeping the room dust free, especially if you have dust allergies or things like that. Air purifier in the room to take that out, especially if you're sensitive to it. Medications, some medications are known to contribute to snoring, right? Any type of sedative, anything that causes the muscles to relax is going to make you more likely to snore. So a lot of times I'll go through the medication list with people and just see, okay, is this something that you need to check it to help alleviate snoring? Right. In contrast to that, as opposed to antihistamines may actually help alleviate snoring. So again, and what do antihistamines do? They relieve nasal congestion. So they open up the airways. One of the things that I think can be really helpful, and I actually try to do this during my workouts, and I try to tell people to do this whenever they can, is to breathe through your nose, like whenever you can. A lot of people are mouth breathers. Breathing through your nose. Breathing through your nose has so many benefits. One of them is it causes your body to secrete more NO, nitric oxide. helps open up blood vessels, therefore helps oxygenate the tissues. Also, your nose is a much better filter for allergens than your mouth. It also helps with humidity, so keeping the tissues moist. And it also helps with keeping the breathing pressure more optimal. So nose breathing is something that people should really get into practice of. And you know, some people, it's not appropriate for all, but some people will actually use, you've seen these things where you can tape your mouth at night.
I've seen that.
Yeah. Yeah.
People are kind of looking like a shark.
Yeah. Yeah. So you breathe, you tape your mouth and then you breathe through you're forced to kind of breathe through your nose all night. I don't recommend that for everybody,
Yeah, I was
especially
about
if you
to say,
have,
I don't know if I support that one.
yeah, especially if you have any type of like where you're already struggling with breathing or you have nasal congestion and all that. But for people who have mild like sleep apnea or snoring, it may be helpful. It may be helpful. One thing I find fascinating is that a lot of it has to do with muscle tone. And so there are exercises you can also do to help. And there you can find these things on the internet. They're like tongue exercises and, you know, like sticking out your tongue up against, you know, trying to touch it to your nose, or, you know, pressing it against the palate, your hard palate as hard as you can, pressing it to the side. Like there's all kinds of exercises that you can look at that may help. You know, a lot of these exercises are like 5 minutes long or so that can help.
Yeah, including like face and throat exercises too. So yeah, the tongue and the mouth, but also like tonifying.
Yeah,
muscles
what
of
do
the
you know any
face.
specific ones for that?
I've heard of a few. I haven't used them personally in clinic for anything like this, but like,
Yeah,
you know, kind of hooking the cheek out and then drawing it actively with
right.
the musculature, drawing it back in. But
Yeah,
the end goal with all of them just seems to be kind of tonifying all these different muscles, whether it be of the throat, the face, or oral, pharyngeal, kind of the ones that kind of control the tongue.
yeah.
All about
And
toning.
speaking of that, so singing, right? Singing works all
Yeah.
those muscles. So
Yeah.
there's been some research that show that singing may help with snoring.
And apparently it's more, and again, I'm not the expert here, but it is apparently like the vowels that will make a real big difference.
Right.
Specifically helping with snoring is kind of singing and pronunciating those vowels.
Yeah. Yeah, I find that fascinating. I mean, singing seems to be I can't sing. I'm not going to subject anybody to that,
What do
but
you mean? You sang, I think it was 2 or 3 episodes ago.
yeah, and it was awful. But singing does help. Humming is another thing that can help, right? So if you hum, you create a vibration that can break up congestion. But singing to definitely tonify the muscles in the mouth can help.
Yeah, and the only thing I can think of in regards to stretch, or where you would want to stretch, or any of those muscles that would kind of be pulling you into more of that kind of like that laying on your back, kind of closed throat type posture. So thinking about like the sternocleidomastoid muscle, kind of making sure that has enough length to it, so you're not constantly being like pulled down and closing down these spaces.
Yeah.
We've talked about like the deep neck flexors and things like that, which will kind of help control how much of a lordotic curvature you get to the neck, that backward bending of the neck, which could close down.
Yeah, so all you're trying to do is open up the airways.
Yeah, just keeping them open and able to be freely moving while you are so rested. And like you're talking about with sleeping, where everything does, all the soft tissue does obviously kind of relax down into
right. Yeah, and when you're laying flat on your back, the soft tissue is being pulled down by gravity. Also, when you're in deep sleep, you lose your tonification of the soft palate. So one of the things that can help, and I've had some of my patients do that, which helps a little bit, is to raise the head of your bed a little bit to fight the effects of gravity. So that may be something that people could try. I've tested people for food sensitivities also. There are foods that can create more mucus and more congestion in the soft tissues in the throat. So usually dairy and citrus is a big one.
Citrus is a big one that can cause it?
Yeah, just for some people can cause mucus, and just create, some issues there. But I also tell people, like, really to combat all of that, one of the best things you can do is to drink water. stay hydrated, right? Because water acts like it's a natural antihistamine for one thing, but staying well hydrated can keep those tissues from swelling and being congested from allergens and stuff. And so it keeps your throat clean and that type of thing. The other thing I want to bring up, I forgot to mention this, is I found it interesting that people who at night tend to have poor oral hygiene also, right? So mouth breathing causes the bacteria in your mouth, especially on your teeth and gums, to kind of like that. So it creates an environment for them to create more, cavities and, just problems in the mouth, whereas nose breathing does not do that. So you bypass that. So again, another reason to nose breathe when you can.
Yeah, and from all those reasons you mentioned, but even just from a biomechanical perspective, you're so much more designed to nose breathe, get it filtered through the nasal hairs and nasal passages,
Right.
and it even, and I know there's research on it, I don't have any specifically right now to quote, but we know like the vagus nerve kind of stimulating your parasympathetic versus your sympathetic nervous system does kind of relate to those deep nasal breathing versus like a rapid, shallower breath that you're going to get from kind of when you're breathing through your mouth.
Right.
And all that's going to help relate to sleep.
Yep. Yeah. So let's say that you've tried all of this stuff and you're still snoring. So there are, of course, surgical interventions that you can certainly try. There are also, I think there's like little devices that you can get fitted for. They're not actually surgical procedures, but can help lift your soft palate. Those are things you can talk to your doctor about. I'm sure dentists know a lot about these things, but as far as surgical procedures, there's something called a palatal implant. So it's called pillar procedure. It's basically a minor surgery that can help with reducing snoring, help reduce severe cases of sleep apnea, and it involves inserting like little rods, like little you can think of little columns in your kind of soft palate. Just keeps the tissues more rigid and keeps them from being relaxed and causes less vibration and snore. Now, of course, with all of this stuff, there are side effects of these things. So it's really a last resort.
Yeah.
That you want to do. There's something called, let me see if I can pronounce this name. The acronym is UPPP, Uvolo Palato Pharyngeal Plasti procedure. So UPPP, it's done, it's a local anesthetic that just involves removing the soft tissue that's kind of dropping in the back and in the top of the throat. This may include the uvula, that's the little thing hanging in the back of your throat. Some people, that's the main issue. Like sometimes that piece of tissue that hangs in the back of the throat may be excessively large. Also, snoring can also be maybe your adenoids or tonsils, especially in children. If they're really big, maybe that's a cause for children to snore, but also in adults. So you can see that. So just see if there's something there obstructing that.
It's making me laugh thinking about just the surgeries that we do and some of our solutions. It was just making me think of like a laminectomy, like when people have back pain. It's like, all right, let's just let's take half the back out. Let's just take that out. Yeah, we'll be good to go.
Yeah, and the extreme of that is a lobotomy. Let's just mix the brain up, and yeah, I mean, yeah, we're crazy with stuff like that, right? But this is why these surgeries really should be,
last resort.
Yeah. Oh, definitely a last resort, because the UPPP surgery can create all kinds of side effects, right? So you can have problems swallowing, you can have voice changes, you can have this permanent feeling of feeling something in your throat, so it's like really know what you're doing first with all of that stuff. What else? There's a Maxillomandibular Advancement, MMA. We're not talking about fighting here. We're talking about a surgery for basically it's like a procedure that moves the bone, like the upper bone maxilla, and the mandible in a way to help open up the airways. So what, anytime you're doing that, what's the side effect of that? Well, possibly facial deformity, so it's like, yeah, no thanks. But again, weigh the advantages and disadvantages.
Yeah.
Hypoglossal nerve stimulation is another one. This is the nerve that controls the muscles in the upper airway. Basically, there's a device that's implanted that can keep tone on those muscles. So that's another one. And then, septoplasty, and it's basically fix if there's any obstruction in the nose, that can certainly help. Any like deviated septum, you can certainly do that. There's a number of other ones also, but I just tell people to try all the other stuff first and see if it will help.
Yeah.
I mean, seriously, for some of my patients, just a 5 to 10 pound weight loss can significantly solve the problem, especially for the patients that are overweight.
Are there any specific herbs or kind of different conglomerations of herbs, teas, or just different remedies that you really do find help, or anything that you really use to like open the nasal passages and kind of the airway too?
Well, besides the obvious, like a neti pot can really help. There are herbs, and typically, any herbs that have more like a nervine sedative type action, you kind of want to do away with those. Any herbs that can act like a antihistamine or have kind of that may help. Water acts like a natural antihistamine. There are certain supplements that do too. Quercetin may act like a natural antihistamine. Vitamin C may actually help. So there's a number of things that may help. There's not a lot of good on those things,
Right.
with the exception of the NAPOT. There's not a lot of good research on doing on that stuff. But the nice thing about it is it's not going to hurt. Like the surgeries can give you a lot of.
Yeah, it's certainly not a
negatives.
UPPPP.
Yeah, stay away from the UPPPP. Yeah. But anyway, so I just tell people, like, yeah, really just be careful, because with any surgery, we're not just talking about snoring surgery. I mean, infection's a big issue. Go back and listen to our podcast that we did on pre and post surgery. Chronic pain and soreness after the surgery, sore throat, dryness in your mouth. The snoring, it may not stop the snoring, so you get the surgery and you're still snoring. Long-lasting physical discomfort, change in voice. All those things are things that can happen with surgery.
Yeah, even here would be a good one to go back and listen to the virtual surgery podcast. Make sure you try everything and have a very clear, because just like you said, your doctor or surgeon really better be able to tell you that this is exactly what's causing your snoring, and getting rid of the roof of your mouth or whatever the case may be is 100%, 99.9% going to resolve it. Like, we know this is the problem, and too often we don't know.
Right. So I think, like, for most people that snore, really check your body fat and your BMI, body mass index, see where you are there, and make sure you're well hydrated, cut out the alcohol, check your meds. A lot of times those things, going down that checklist, can really help. So, body mass index 25 or under, I think is a good thing to shoot for most people. Body fat, I would say also 25% or under. I'm talking for both genders here. Can really help. So see where you are there. And most of us are over definitely the body fat of 25%,
And if you're a male over that, you need to address that.
Right. Oh yeah, no doubt. But most men over 50 years of age are over that, so that plays a significant role in snoring.
That is so crazy.
Yeah,
just to be like a quarter of fat, essentially.
Yep.
Of you.
Right.
Non-usable, non-functional tissue. Like, oh man.
Yeah, I think, I mean, correct me if I'm wrong, but I think if you're 25% over 25% body fat, you are considered obese as a male. Over 30%, you're considered morbidly obese as a male. For women, I think you're just considered over 25%. Maybe you're just considered overweight, and
Yeah,
then
that
30%.
sounds right.
Yeah, it's
Like,
something like
yeah.
that. But you really do want to um, do that. And so so we talked about muscle tone, right? Well, working any of your muscles actually will help with snoring. So doing regular exercise can actually help snoring, whether you're overweight or not. So there's some research that also says that. Sorry, we didn't say that at the beginning, but exercise is huge.
Yeah, absolutely.
It's kind of like one of those things we forget to mention because it's so, helps, it pretty much helps just about everything. But that is one way to significantly help.
Yeah, and because we keep talking about tone, I think it's important to mention, and this is what I try and tell people, patients that I'm treating with back pain, is if we're trying to address tone, which we kind of are with these throat exercises, these mouth exercises, we want to. The research shows that we want to kind of do these exercises daily, because the way I explain it is like, we have these biomechanical patterns, and some muscles aren't activating or turning on or being used at their fullest capacity. And if we're trying to turn those muscles on, we kind of want to really focus on turning them on. And again, turning them on is a really loose layman way of explaining how they're going to be activated by the nervous system.
Right.
But we want to turn them on, and we want to kind of turn them on daily because we've become so habitual with not turning them on, and then
Yeah.
being habitual and focused about turning them on and doing that daily is what's going to kind of ignite that ability to keep that tone. So
Yeah.
like, even like with your core for like a lower back for pain, for example, you want to do these exercises daily, even if you're not doing all the sets and reps, or you're just connecting with the muscle, because that's increasing that tone, and then that's increasing your ability to produce that tone, keep that tone. And that's what it said as I even kind of flipped through just some generic PT and snoring type stuff, is it's best to do these mouth and facial exercises daily. And then it took like 3 months for them to actually have an effect on the snoring, but they did.
Yeah,
So
that's
it's important,
cool.
if you're focusing on tone and kind of connecting with a muscle, you need to do that daily to really kickstart your progress and actually see what you're trying to get.
Yeah. Yeah, I mean, it's making me. I wonder if. Well, we talked about singing, like helping with tone, because you're really hitting different sounds, especially the
Mm-hmm.
vowel sounds. Really stimulates a lot of the muscles in the back of the throat. I wonder if the muscles in the front of the mouth, like the masseter muscle, and like for chewing, like I wonder if chewing would help. Like if you're chewing gum, I wonder if just swallowing exercises would help with that too. I haven't seen anything specifically on that, but
Yeah,
it
from what
seems like,
I've seen, absolutely. Some,
oh,
like,
okay.
even those facial type exercises, pursing your lips and things like that, all were in there as
Oh,
means to
okay.
help.
Yeah,
Yeah.
that's good to know. Okay. Yeah, so definitely check that out. Also, if some of these natural remedies or lifestyle changes don't help, definitely see a doctor about it, because maybe there is something that is causing obstruction that's more than just the tissues not being toned, right? So we talked about swollen, enlarged adenoids, maybe a cleft palate that's in the back, a large uvula. What else? A deviated septum, that type of thing.
Well,
Um,
how would you recommend, Keoni, someone kind of track their progress with this? Because obviously that could be a little challenging.
yeah.
And let's assume you don't have a loved one who will let you
Yep.
know every single time.
Well, there are sleep apps out there. There are things that will record your snoring, and will pick you up. You can actually record your snoring now and see how, the noise level and all that. So a lot of sleep
There you
apps can
go.
help with that.
Okay.
Where you can definitely assess that. I think one of the things I ask all my patients is, how's your sleep? I mean, do you wake up feeling rested most days? And especially if you don't have a partner that can sit there and tell you, man, you're snoring all night last night, kept me up. Um, I think, looking at some of those signs, like, is your throat always dry when you get up? Do you constantly mouth breathe? Do you when you focus on it? Are you breathing through your mouth? Do you just feel fatigued most days? Is your blood pressure going up? I mean, that's a huge one. And at some point, we didn't mention it. We'll talk about it because we're going to do a 2-part series on this. Next one, we'll specifically talk about sleep apnea. But you may want to do a sleep study just to see what's actually going on. For a lot of people that do sleep studies, the sleep apnea is the biggest issue. So, snoring sleep apnea can be the biggest issue for making you feel tired. And for sleep apnea, it's very easy to solve that issue, using a CPAP or something like that.
Right.
And a lot of my patients who, if they can find one that's comfortable or get used to it, they feel like new people. So you're actually you're getting oxygen to your tissues. You generally feel much better than you have. And therefore, once you oxygenate your tissues, you're better able to lose weight. You're better able to feel motivated to go do something. You don't feel like you have a hangover constantly. So we'll talk about that soon, but those are the main things. Sleep, the apps, some of the apps on the phone can really help with that.
Yeah. Awesome. Anything else, Keoni?
I don't think so. I think we covered everything.
Yeah, as far as those exercises, you can easily just Google snoring exercises, snoring physical therapy exercises, whatever. And there's a variety of YouTube videos and kind of list. I don't have any experience with anything specifically like working out other than, treating a patient for shoulder. And they're talking to me about snoring. And I'm like, yeah, you can try this or that. And then, it's not what I'm mainly tracking. So I haven't really seen the outcome specifically, but especially if it's a mechanical cause, like we were kind of talking about in the very, very beginning, there's no reason why this stuff shouldn't help. And probably for everyone, at the very least, tonifying these muscles is probably something that most people are not doing, and can
need,
at least take the edge off.
anyway.
Yeah.
And like like we said at the beginning, age is a main factor for snoring. As we age, whether you're overweight or not, you're going to be more likely to snore a lot of time, and that has to do with the tone.
So go sing in the shower.
Yep. Oh, yeah. That's right. Sing in the shower. Yep. That would be a cure for a lot of things.
All right, everybody. Until next week, we will talk with you then. Until then, be well.
Take care, everybody.